Let's bring in infectious disease specialist Dr. Isaac Bogoch, who is in Toronto. And Dr. Bogoch, numbers down in Ontario today. I know it's just one day, but still. And in the red zone in Quebec, also numbers maybe a little lower than we've seen in the past. Are we getting some things right?
I think we're getting things right in terms of policy. We've certainly seen a big pivot and an adjustment on behalf of many of the provincial governments. And hopefully this policy will really ensure that we do see a lower number of cases. But just today, seeing these cases a little bit lower, I think it's too soon to tell if we're actually headed in the right direction.
And I know you continue to have concerns. Take us through those, please.
Yeah, one of them is that Canadians in general are doing fantastic, but one of the concerns is complacency, and certainly we really need to be vigilant throughout the fall and the winter. I think the second one is the influenza season is upon us, and just because the Southern Hemisphere had a pretty mild influenza season, that's no guarantee that we'll have a mild one. So we really need to do the right thing, get our flu shots, and hopefully the same public health measures like physical distancing and mask wearing and hand hygiene will enable a more smooth influenza season. And then, lastly, it's only October. There's a long fall and winter ahead. And while we're doing okay now, there's plenty of time for things to get better, but that means there's also plenty of times for things to get worse. So we really need to be vigilant throughout the fall and the winter.
I know this has been a busy on-call day for you. Thanks for fitting us in.
My pleasure.